Dr. Christopher Duntsch was a brilliant neurosurgeon who turned out to be a monster. Once he was called a medical genius, but now he is known as Dr. Death. With a scalpel in his hand and a god complex in his heart, Duntsch went on a rampage. He left a trail of maimed and murdered patients in his wake. 33 lives were forever changed, or ended, by this twisted man. But what drove this genius towards evil, and how did he manage to evade justice for so long? Dive into the chilling true story of Dr. Duntsch, the surgeon who turned his operating room into a chamber of horrors. The rise of Dr. Duntsch. Dr. Christopher Duntsch was born on April 3, 1971 in Montana. His parents, Donald and Susan, were dedicated professionals. His dad was a physical therapist and Christian missionary, while his mom was a school teacher. Chris was the oldest of 4 siblings, and by all accounts, they had a pretty normal upbringing. Chris was a decent student, but his true passion was football. He played in high school and even earned a scholarship to Millsaps College in Mississippi. Despite his determination and hard work, he just couldn't master the game. After abandoning his football dreams, Chris turned to medicine. He transferred to Colorado State University and later attended Memphis State University. It was there that he discovered neurosurgery. He went on to complete his MD, PhD, and residency programs at the University of Tennessee Health Science Center. Red flags in Duntsch's medical career. Duntsch's medical career was marked by red flags from the start. He was suspected of operating under the influence of cocaine in his 4th year of residency. He was sent to a program for impaired physicians but was allowed to complete his residency. Duntsch performed only 100 surgeries during his residency, far fewer than the typical 1,000 required. He still managed to secure a diploma and went on to complete a spine fellowship program. His impressive CV and charisma landed him a job at Baylor Plano Medical Center in Texas in 2011, with a salary of $600,000 per year plus bonuses. Duntsch's credentials were not entirely accurate. He claimed to have graduated magna cum laude from St. Jude Children's Research Hospital with a doctorate in microbiology, but the hospital did not offer such a program at the time. Duntsch's personal life was also troubled. He was heavily in debt and had a tumultuous relationship with exotic dancer, with whom he had 2 sons. His focus on neurosurgery was motivated by the potential for financial gain. His patients would soon pay the price for his troubles. Duntsch's life started to unravel around 2006. He began using LSD and cocaine and would often party all night before heading to work. His colleagues at Baylor Plano were unimpressed with his surgical skills, and he was known to boast about his abilities despite being new to the area. Initially, Dr. Randall Kirby, a veteran surgeon, thought was a great addition to the team. However, his opinion soon changed when Duntsch's first operation at the hospital ended in disaster. The victims of Dr. Death. Ken Fennell suffered from chronic back pain and consulted Duntsch to improve his quality of life. But after an unsuccessful first operation, operated on the wrong area, Ken's life took a devastating turn. Duntsch convinced Ken to have a second operation which left him almost completely paralyzed from the waist down. Today, Ken uses a wheelchair to get around and can only walk 10 meters before needing to sit down. Despite this disastrous surgery, Duntsch continued to attract patients with his confidence and charisma. You'd think that even a friend would be safe in Dr. Duntsch's hands, but unfortunately that wasn't the case. Jerry Summers, a longtime friend of Duntsch, went under the knife for a routine spinal fusion surgery in February 2012. Tragically, he woke up as a quadriplegic, meaning he had lost the use of all 4 limbs. His arms and legs were paralyzed. In Jerry's case, his quadriplegia was incomplete, meaning he could still feel pain but was unable to move from the neck down. The surgery was a disaster, with Duntsch botching the removal of a disc and constricting the spinal cord with a large amount of gel foam. Jerry lost a massive amount of blood, almost 1,200 milliliters, and was left with catastrophic injuries. Despite his condition, Duntsch refused to perform revision surgery, leaving Jerry to suffer the consequences. He passed away in 2021 due to complications from the surgery. The pattern of Duntsch's botched operations is chillingly consistent, with many patients left paralyzed or in chronic pain due to his negligence. Kelly Martin's story is another tragic example, but she wasn't just left paralyzed, she was killed. In November 2011, Kelly, a 54-year-old schoolteacher from Garland, Texas, was excitedly preparing for Christmas when she fell from a stepladder and severely injured her back. Determined not to ruin the festive season for her loved ones, Kelly sought help from Dr. Christopher Duntsch, a neurosurgeon with a prestigious reputation. Her first consultation went well, and Duntsch reassured her that herniated disc surgery was a common procedure. Kelly underwent surgery, but something went horribly wrong. Her husband, Don, waited anxiously in the waiting room, but 1.5 hours passed and Kelly still hadn't emerged. When Duntsch finally appeared, he claimed the surgery went well, but Kelly was in extreme pain. Don's instincts told him something was off, and he called their daughters to rush to the hospital. 2 hours later, the ER doctor arrived with Duntsch and delivered the devastating news. "We did everything we could." Kelly had died from internal bleeding due to a severed artery. The family was shocked and heartbroken. How could a simple routine operation go so catastrophically wrong? The testimony of medical professionals and experts reveals a shocking pattern of incompetence and arrogance. Duntsch cut through Kelly's spinal cord and severed an artery, causing massive blood loss. Despite clear signs of distress and warnings from his colleagues, Duntsch continued operating, refusing to acknowledge anything was wrong. After the surgery, Kelly was screaming and clawing at her legs, forcing the ICU team to re-anesthetize her. Duntsch remained in the waiting room, writing notes instead of attending to his patient. When Kelly went into hemorrhagic cardiac arrest, Duntsch's inaction sealed her fate. She bled to death due to his gross negligence. The aftermath of Kelly's death was just as alarming. Duntsch requested and received a copy of the autopsy report, which ruled her death an accidental therapeutic misadventure. The Baylor Physician Peer Review Committee found Duntsch at fault, and his surgical privileges were revoked. Yet, Duntsch claimed he voluntarily resigned, and Baylor's initial letter did not indicate any problems. After Kelly Martin's death, Baylor Plano Hospital allowed Duntsch to resign quietly, enabling him to easily secure a position at Dallas Medical Center. At Dallas Medical Center, Duntsch's negligence continued, resulting in the death of Floella Brown and severe injury to Mary Ifward. Duntsch's actions showed a disturbing pattern of gross incompetence, lack of empathy, drug and alcohol addiction, and motivation by financial gain. His patients suffered severe and often permanent damage, including paralysis, nerve damage, and death. The medical community was shocked by the extent of his errors, with one surgeon describing his work as that of a crazed maniac. Dr. Duntsch was able to continue practicing medicine despite his incompetence because hospitals valued him as a lucrative source of revenue. Instead of firing him, hospitals allowed him to resign quietly, preserving his reputation. Some hospitals failed to report his mistakes to the national database, which is meant to track problem practitioners and warn potential employers. This allowed Duntsch to move from hospital to hospital, continuing to harm patients. Attorney Kay Van Way described this as a common practice, prioritizing protecting the hospital and the doctor over patient safety, and passing the problem to someone else. The fall of Dr. Death. Dr. Death was arrested in 2015 for his botched surgeries that resulted in the death of 2 patients and left 2 others with disabling injuries. He was indicted on 5 counts of aggravated assault and 1 count of harming an elderly person. Duntsch pleaded not guilty, but was later convicted and sentenced to life in prison in February 2017. This made him the first doctor in the U.S. to receive a life sentence for his practice of medicine. His medical license was suspended by the Texas Medical Board in 2013. A new law was passed in June 2023 to prevent doctors with revoked licenses from practicing in Texas. It also required the local medical board to inform the public of disciplinary actions against physicians. As Dr. Duntsch rots behind bars, we're confronted with the chilling reality that the very hands meant to heal can also be the ones that inflict the most devastating harm. Let us honor the victims by creating a safer, more just system for all. Thanks for watching. Stay tuned for more shocking true stories and cases that will leave you speechless.